Hello, everyone. My name is Stephanie Padilla, and the bacterium I chose to do my research on is Bacillus anthracis. And Bacillus anthracis causes the disease anthrax. Okay, so anthrax may sound familiar to some of you because in 2001, after 9/11, there was an attack on America with anthrax. The letters were mailed out to Congress and media networks that contained white powder with endospores of Bacillus anthracis. Five people died and several were infected. This was a very extensive investigation by the FBI, and Dr. Bruce Ivins was going to be prosecuted but committed suicide before the charges were able to be put on him. So let's talk about the taxonomy of Bacillus anthracis. It is the kingdom bacteria, and then from the subkingdom Posibacterium, from the phylum Firmicutes, the class Bacilli, then the order is Bacillales. The family is Bacilliaceae from the genus Bacillus and the species Bacillus anthracis. So the morphology of Bacillus anthracis is that it is a gram-positive rod and it forms endospores. It is non-motile, is an obligate aerobe, and the size of the bacillus is 1 to 1.5 micrometers by 3 to 10 micrometers in length. Bacillus anthracis usually form short chains or can be seen as single pairs. The habitat of Bacillus anthracis is that it's naturally occurring in soil. The endospores are usually disturbed by animals or humans. Animals kick up the spores and either inhale it or ingest it. Then we humans eat the meat. It is rare to find anthrax in the US because the United States has vaccine for livestock to prevent anthrax infections. And in the developing countries, um, livestock aren't do not have the vaccine readily available. So be cautious when traveling. The virulence factors for Bacillus anthracis is that it has a polypeptide capsule, and as if you remember, a capsule helps with the virulence factor because white blood cells are not able to engulf the microbe because of the capsule. So this makes it very hard for our white blood cells to kill the microbe. Bacillus anthracis has two plasmids, the PX01 and PX02. Here I have Bacillus cereus and Bacillus anthracis. These are both very similar because they are from the same genus. And what separates the two is that Bacillus anthracis has those plasmids that encodes for toxins. So PX01 encodes for necrosis, which is death of cells, hemorrhage, which is severe bleeding, and edema, which is swelling. PX02 encodes for the polypeptide capsule. And Bacillus cereus has none of that, making Bacillus anthracis um, very lethal in when it comes to infection compared to Bacillus cereus. So there are three types of anthrax. There is gastrointestinal anthrax, inhalation anthrax, and cutaneous anthrax. I will talk about these and how they're acquired later on. Who's at risk? There are groups of people who are at most risk for anthrax infection, and it will be laboratory scientists who work with labs that have anthrax in who work with anthrax. Excuse me. Then we have people who work with um, animal products like wool, hide, and hairs. And this person may be more susceptible to it because the animal might be infected with anthrax. Here, we have military personnel who are also at a higher risk for infection of anthrax because of the attack in 2001. Um, but anthrax can be used as a biological weapon against military personnel or other members that could be high risk in government. Also, travelers would be at risk as well because in case you're traveling with areas that might have known outbreaks of anthrax, you should be cautious and practice some preventive methods that I will talk about later on. Okay, so let's talk about cutaneous anthrax. Um, The way that this is acquired is that endospores get into a cut or abrasion on the skin. This is the most common form and least fatal of anthrax, and 95% of anthrax infections are cutaneous. The incubation period is 1 to 7 days after exposure. This causes death to cells. Signs are blisters and bumps on the hands, neck, face, or arms. Blisters then form to an ulcer, which then the ulcer turns into a black scab called an eschar. This is usually followed by edema. Symptom usually painless ulcer. So here we have a picture of a characteristic um, eschar of cutaneous anthrax. It's black, and here we have another skin lesion with the eschar here on the leg. Here is a scar from an leftover from an eschar on the neck, and this is a very severe um, cutaneous anthrax infection where this person handled infected animal products and caused all these um, th- called the necrosis on the skin and inflammation. Another form is called inhalation anthrax, and this is the deadliest form, which happened in 2001. This progresses very quickly because the endospores will be inhaled, and then will come into the lungs, and then start producing toxins into the alveolar sacs. The spores are inhaled, and then the incubation period could be from 1 week to 2 months. So, treatments give 55% survival rate for this type of infection, and treatments are antibiotics. Symptoms include flu-like symptoms like fever, chills, non-productive cough, and coughing up blood, shortness of breath, and sweats. The signs are sore throat, fatigue, and soreness. The other form of anthrax is gastrointestinal anthrax, and this is acquired by eating raw or undercooked meat that may have been coming from an infected animal with anthrax. This affects the GI tract, and signs to be looked for are abdominal pain, loss of appetite, sore throat, difficulty swallowing. Symptoms include fever, bloody diarrhea, swelling of abdomen, vomiting blood, swelling of neck or neck glands, septicemia. Without treatment, there is a high mortality rate, but 60% of infected survive with the proper treatment of antibiotics. To diagnose anthrax, there's a few tests that are performed. A skin biopsy is usually taken from a lesion to view under a microscope to see if it has Bacillus anthracis. And then chest X-rays are also ordered if there's a probable cause of infection of inhalation anthrax. And here, what they're looking for is the mediastinal widening in the chest X-rays. Blood and respiratory secretion samples are also performed, and doctors usually work with a special laboratory called the LPN, and this laboratory will perform the special test to confirm anthrax. Treatments for anthrax. Um, Antibiotics are given to prevent the onset of anthrax, which will inhibit the growth of the bacterium. So the antibiotics are ciprofloxacin and doxycycline. This is to be taken for 60 days because these endospores can stay in our body and for up to 60 days before they germinate. For inhalation anthrax and symptoms of anthrax, antitoxins may be prescribed. And antitoxins do not go after the bacteria, but they do go after the toxins. So it will kill the toxins. And these will be raxibacum and obiotaximab. Is there a vaccine for anthrax? Yes, there is. The vaccine is given to three special groups. They will be laboratory workers who work in labs with anthrax, some veterinarians who may be working with livestock that could be susceptible to infection of anthrax, and some members of the US military, because of anthrax being used as a biological weapon. They're more at high risk for being attacked with anthrax. The anthrax vaccine, Absorb AVA, is approved by the FDA, and It is used for prevention of anthrax and after exposure to anthrax. It is given via intramuscular injection and in 5 doses in the span of 18 months. Then a yearly booster shot is given for full protection. The vaccine is is made from cell-free filtrates of a avirulent, non-encapsulated strain of Bacillus anthracis. No dead or live bacteria are in the vaccine. The effectiveness of vaccine is 93% protection from anthrax. And if the series is completed with yearly booster shots, a person will be protected. Prevention of anthrax is buying animal hides from the US. This buying animal hides from the US because in developing countries, the vaccine is not readily available. Therefore, endospores can be in these hides and animal products. Also, do not eat raw or undercooked meat if traveling to a place that may have outbreaks of anthrax. Fully cook your meat. Avoid contact with livestock or animal products if you are traveling with places that have anthrax outbreaks. These are my resources, and I hope you think that Bacillus anthracis is very interesting. I did, and I enjoyed this research paper and presentations. Thank you.